What if we could wipe out millions of medication errors with just one single change? Well, today, we're going to dive into e-prescribing, a technology that's actually doing just that. And let me tell you, this is way more than just swapping a pen for a keyboard. It's a fundamental upgrade to how we handle medicine. We're going to break down all the core benefits that are making healthcare safer, way more efficient, and just better for everyone involved. So here's how we'll tackle it. First, we'll talk about the real, high-stakes problem with old-school paper prescriptions. Then, we'll see how the digital solution directly improves clinical outcomes and makes doctors' offices run smoother. After that, we'll zoom out to see the value for the entire system, and finally, we'll get a little peek into what's next.
All right, first up, the problem with paper. For decades, this little pad was the standard of care. But the truth is, a handwritten prescription carries some serious and often totally hidden dangers for both patients and the people treating them. I want you to just let this number sink in for a second. 1.5 million. According to the Institute of Medicine, that's how many preventable, harmful drug events happen in the U.S. every single year. And a huge portion of those trace right back to simple mistakes in the prescribing process. The kind of slip-ups that are just way too easy with paper. And this slide really lays it all out. On the left, you've got the chaos of paper. Messy, illegible handwriting, scripts that get lost or even forged, and absolutely no safety net. Then on the right, you have the digital solution. It's clear, it's secure, and it's intelligent, with safety checks literally built right in. The difference is just night and day. So, how exactly does e-prescribing fix this mess? Let's get into the most important benefits, the ones that directly boost clinical care and patient safety. Because this, right here, is where the technology really, truly shines.
We're going to focus on 4 key clinical wins here. Everything from drastically cutting down on errors, to providing real-time alerts, to helping patients actually take their medicine, and finally, giving doctors a complete picture of a patient's medication history.
Now, check this out, because this isn't just a theory. The proof is in the data. A landmark study found that after medical practices switched to e-prescribing, medication error rates absolutely plummeted. They went from nearly 43 errors for every 100 prescriptions all the way down to just over 6. That's a massive 7-fold drop in mistakes. It's one of the clearest examples you'll ever see of technology making patients safer. So how does it pull that off? Well, a huge piece of the puzzle is something called clinical decision support. As a doctor is typing in a prescription, the system is working in the background, checking it against the patient's entire record. It instantly flags potential dangers, like a new drug that might interact badly with another one or an allergy the patient has. It's kind of like having an expert safety consultant looking over your shoulder on every single prescription. And here's another game changer. A prescription doesn't do any good if the patient never actually fills it, right? Well, research found a 10% jump in what's called first fill adherence with e-prescribing. Just by sending that script directly to the pharmacy, you eliminate the chance it gets lost in a purse or forgotten on the counter, making it so much more likely that patients actually start their treatment.
So patient safety is number one, obviously. But e-prescribing also delivers some massive wins on the operational side of things. It just makes the whole process smoother, faster, and way less frustrating for both the medical practice and the pharmacy.
And this means a lot of things. Prescriptions get filled faster. There's less administrative busy work for staff. Care gets coordinated better between providers. And it provides the essential backbone for telehealth to even work. Really, this is all about freeing up time. Just think about all the hours wasted by pharmacists calling the doctor's office to clarify some unreadable handwriting, or staff handling manual refill requests. E-prescribing automates so much of this, which gives clinicians more time to do what they're actually supposed to be doing, taking care of patients.
And you can actually measure this impact. An audit found that the average pharmacist saves 54 minutes every single day because of the efficiencies from e-prescribing. That is nearly an hour of time per pharmacist that can go back to counseling patients and other critical work. When you multiply that across every pharmacy in the country, well, the time savings are just astronomical.
And this has become so incredibly important lately. Telehealth is a huge part of healthcare now, but a virtual visit doesn't mean much if the patient then has to physically go pick up a paper script. E-prescribing closes that loop. A doctor can end a video call and with just a few clicks, have the prescription ready and waiting at the patient's pharmacy. It makes remote care a truly seamless, complete experience.
Now let's zoom out even further. Because beyond individual patients and practices, e-prescribing creates enormous value for the entire healthcare system, both in terms of money saved and much, much better security.
We'll hit on 4 major benefits here. Huge cost savings, powerful fraud prevention, new data insights, and the ability for this to scale up for really large health networks.
The financial numbers here are just staggering. One analysis projected that if e-prescribing was widely adopted, it could save the U.S. healthcare system somewhere between $140 and $240 billion over 10 years. And that's not from just one thing. It's a combination of reducing those expensive adverse drug events, improving adherence, which keeps people healthier, and making it easier for doctors to prescribe cheaper generic drugs.
Then there's the security side, which is a massive system-level benefit. Paper prescriptions for controlled substances are so vulnerable. They can be stolen, forged, you name it. Electronic prescribing of controlled substances, or EPCS, creates a secure, trackable digital trail. This makes it way harder for fraud and drug diversion to happen, giving everyone a vital tool in fighting huge problems like the opioid crisis.
All right, finally, let's look ahead. Now, the transition isn't always perfect, but the path forward is pretty clear, and there are innovations coming that will make this technology even more powerful.
Of course, it's not without its challenges. The initial cost to set these systems up can be a real barrier for some practices. Sometimes, poorly designed systems can cause alert fatigue, where doctors get so many warnings they start to ignore the important ones. And of course, data privacy and making sure different systems can talk to each other are ongoing issues.
But the future here is incredibly exciting. The next wave of e-prescribing systems are being built with AI and machine learning. Just imagine a system that doesn't just react to a prescription, but uses predictive analytics to suggest the absolute best medication for that specific patient based on millions of other cases. We're moving toward a new era of truly personalized medicine.
So, we'll leave you with this question to think about. As our entire healthcare world becomes more digital and more data-driven, is stubbornly sticking with paper prescriptions actually the biggest risk of all? It's not just inefficient, it's a risk to your patients, your practice, and the whole system. Thanks for tuning in.